Hello, everyone. Good morning, good afternoon, or good evening to you from wherever in the world you are joining us today. We're glad that you're here. My name is Sigenli Del Canto, and my pronouns are she, her. I was born in Toronto, Canada, and my ancestors are from Sri Lanka. I'm coming to you today from Treaty 4 territory and the homelands of Métis in Saskatoon, Canada. I am grateful to be a guest on these beautiful lands and honor the generations of Indigenous kin who care for the water, the air, and the land. Thank you to the WHO, IBP Network, and Communities, Alliances, and Networks, also known as CAN, for organizing this webinar. Before we begin, I would like to turn it over to Sharp Doppler, who will open the session by grounding our minds and our hearts in this work. Thank you, Sharp.
Ani bojo kwe se goskana goa Sharp Doppler Indigenous Cost Newfoundland and Dunjaba Jijaliga Ashkwaki Memo Irish Anashnavajin Kausa Nimiki Makwa do them Shkabewas Nijo Manatuk or Gichita. My name is Sharp. I live in the unceded traditional territory of the Omano-Winini people, which is commonly known as Ottawa. I acknowledge the elders of all of the traditional territories that we're all coming from here today. Our ancestors are with us when we do this work. What a beautiful thing it is. So to start in a good way, I'll invite you to sit comfortably. We are gathered around water. We are in this continent, spring, the time of water, where Mother Earth sheds that beautiful blanket of white, awakens from her rest, and all of creation leaps to life. And that's what we're doing. And this water is what connects us. What connects us. Water is life. Water is the blood of Mother Earth. It is within us. It is around us. It is the most precious thing on this earth, because without it, we can't live. How beautiful and powerful is it that we are doing this work in the context of water and that connection? How beautiful and powerful is it that we think about reproductive rights and how we spend the first 9 months of our existence in water. All water is sacred. So I want to sing you a little song. If you have water in front of you, or if you have that other blessed water, coffee, that'll do too. I'm going to sing you a water blessing song. It's an Algonquin song. It comes from this territory. And what the words mean are that this water, the water within me, or the water inside of me, it is the blood of Mother Earth. Bibi wabo naya, aki miskwe nibi wabo. Heya, 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 hey. Heya, 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 ho. Nibi wabo naya, aki miskwe nibi wabo. Heya, 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 hey. Heya, 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 ho. Nibi wabo naya, aki miskwe nibi wabo. Heya, 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 hey. Heya, 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 ho. Nibi wabo naya, Akineskwe nibi wabo. Heya, 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 hey. Heya, 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 ho. Sing that song 4 times for the 4 directions on this beautiful earth. This water is blessed by our intention, by our commitment. This water is blessed by each one of us. Take a sip of that water or coffee. Hold it in your mouth. Feel its coolness or its warmth. Swallow it. Feel it go into every cell in your body. And that is no different than the connection we have in doing our work together. Miigwech, Mikanagana, all my relations.
Very much, Sharp. That was beautiful. Our webinar today is Sexual and Reproductive Health Rights, or SRHR, of Indigenous women, girls, and gender diverse communities living within Canada. Please note that this session is being recorded and will be available on can.ca, so CAAN, and other websites within the next few days. If you have any questions for any of the presenters, please type them into the question section of the chat bar. At the end of all the presentations, I will read out loud for the presenters to answer. Sorry, Edos, I skipped ahead. Also on the right-hand side, there are 5 documents for you to download as supplemental information. And then, sorry, Edos, the slide before that. Today we will learn about CAN's research initiatives, the WHO guidelines on the SRHR of women living with HIV, the National Action Plan on the SRHR of women living with HIV in Canada, data analysis from a national cohort study called CHIWOS, the Canadian HIV Women's Sexual and Reproductive Health Cohort Study, a personal story from an Indigenous woman living with HIV, challenges and opportunities of advancing SRHR of Indigenous women at local levels, and finally, operationalizing the WHO guidelines to support Indigenous women living with HIV. Before I turn it over to the presenters, I just want to mention we invite you to share your insights on social media and tag CAN at CAAN_official. Please join me in welcoming today's presenters, and I will turn it over to our first presenter, Patricia Mahecha. Thank you.
Hello, everyone. Thank you, Sugandhi. I want to thank you to the panelists for their commitment to Canada's Indigenous women and girls and the audience for being with us today. I am Patricia Mahecha, the Global Research Manager of Communities, Alliances, and Networks. CAN was established in 1997 and is a crucial voice for Indigenous people living with or affected with HIV or hepatitis C. I would like to acknowledge that I am on the traditional, ancestral, and unceded territory of the Coast Salish peoples, Squamish, Tsleil-Waututh, and Musqueam nations. In 2017, the WHO released a consolidated guideline on the sexual and reproductive health and rights of women living with HIV. Evidence from this report highlighted the inequitable access to quality health services for Indigenous women living with HIV and their extreme vulnerability to gender violence and sexual and reproductive rights violations. This is the name of our project, and this project is being carried out in 7 countries: in New Zealand, Nigeria, Nepal, India, Peru, Guatemala, and Canada. Our project serves to host initiatives to bend the HIV curve in Indigenous women populations. We build local and global capacity through evidence-based and culturally relevant sexual reproductive health rights, knowledge translations tools developed by and for international Indigenous women community. This project will have far-reaching global impacts on the embodied experience of sexual reproductive health rights of Indigenous women living with or impacted by HIV or other STBBIs. We will strengthen a global network of Indigenous communities leaders through capacity building and peer mentorship to integrate sexual reproductive health rights in their communities in ways that benefit Indigenous women through culturally informed and accessible tools and activities. By simultaneously developing tools and activities that celebrate Indigenous ways of knowing and doing, while honoring the diversity of nations across the globe, we are helping to build a global community of citizens advocating for sexual and reproductive health and rights of Indigenous women. Next, please. This is the late title of the project, Measuring Sexual and Reproductive Health and Rights, Responding to the Needs of Indigenous Women and Girls in Global Context. Next, please. We will integrate Indigenous knowledge from the design, development, dissemination, and evaluation throughout the project. We will work to defend the principles of equity, gender equality, and sustainable development among all the population we will relate to. Therefore, for our project, it is paramount that Indigenous ceremonies and traditional activities are honored throughout the project to help guide safe and healthy relationships in a good way. This process includes peer education and mentorship concerning sexuality, relationships, and cultural teachings that are empowering, knowledge-based, and free of stigma, prejudice, and judgment. In this way, Indigenous women and girls are equipped with the knowledge to make the best possible decisions about their sexual and reproductive life. Then they will be able to decide for themselves. For example, if they want to have children, how many, when, if they want family planning, if they want to have sex, and with whom. The project seeks to articulate how to respond effectively to the sexual reproductive health rights of Indigenous women, girls, and gender diverse Indigenous population in culturally appropriate ways and specific contexts. Next, please. The research questions of our project are this one. What are the underlying cultural and structural issues, but also opportunities that could increase Indigenous women and girls' access to safe and effective sexual reproductive health rights? What are appropriate culturally responsive solutions to advance Indigenous women and girls' sexual reproductive health rights? And how do we build Indigenous men's capacity to advocate for optimizing the sexual reproductive health rights of Indigenous women and girls? In addition to these questions, we will develop a specific question for every partner country according with their particular circumstances. Next, please. In cooperation with local groups, the collective knowledge of our team will ensure the project findings are scalable beyond our partners' countries and are relevant to those facing similar issues in their territories. The opportunity to build research capacity and work to heal research relationships with Indigenous communities cannot be understated. Our participant Indigenous women co-researchers will have the opportunity to engage in all levels of research because of our well-developed peer education and mentorship component led by the local teams. Indigenous men and boys will also benefit by building their capacity concerning healthy sexualities and relationships and cultural teachings that are empowering, knowledge-based, and free of stigma and judgment. The overall objective of the team is to develop an Indigenous framework that promotes better well-being through different goals like a better understanding of the barriers that affect the data collection, analysis, use, and communication related to sexual reproductive health rights of Indigenous women, girls, and gender diverse population who live with HIV. Enhance the capacity of Indigenous and allied researchers, civil society professionals, and in-country leaders to collect, analyze, communicate, and use data effectively. Develop the capacities of Indigenous women, girls, and gender diverse population with the support of partner countries to develop global sexual reproductive health rights indicators. And support building among Indigenous people who identify as men and boys, including non-binary people, to be advocates and agents of change for sexual reproductive health rights of Indigenous women. Next, please. What are the products that we are expecting to have? With the development of a core leadership team, this project will enhance the capacity of Indigenous women and girls to participate at all levels of research while strengthening our Indigenous and global alliances. A scoping review on sexual reproductive health rights specific to Indigenous women, girls, and gender diverse population living with HIV will define the structure of the focus group discussions that will take place across the 7 partner countries. We will have capacity building group discussion to increase opportunities for local Indigenous women and anyone who self-identifies as a woman or girl to engage in research activities. These discussions will inform the development of a survey to be applied by the stakeholders in the 7 participating countries. Findings from the focus group discussion will support the development of a survey on sexual reproductive health rights care from an Indigenous perspective and context specific. We will apply the survey to Indigenous women, girls living with or impacted by HIV or other STBBIs, and through a process of capacity bridging involving culturally centered data gathering events. Finally, we will create an Indigenous appropriate toolkit on sexual reproductive health rights based on findings from the focus group discussions, surveys, and scoping reviews. This toolkit will reflect the project's findings developed in each participating country, whose objectives is improving the sexual health and well-being of Indigenous women locally and globally. Bridging capabilities between nations, genders, sexes, ages, and all other dimensions of being will work to honor those who have lost the fights against HIV and AIDS, and those who work to ensure no more lives are lost. Thank you. I will now turn to the floor over to our second presenter, Manuel Narissimo. Manuel.
Thank you so much, Patricia. It's a real honor to be here with such a wonderful group of leaders and women in Canada. I'm really humbled and honored to be here with all of you. I think many of you have seen this presentation and given the webinars that were held in Canada since the publication of this guideline. So while we have these slides as perhaps resources for those who have not seen this before, I will just go through them quite quickly and be open to questions at the end. So just a few words of introduction here is to say that this guideline is really meant to help countries to more effectively and efficiently plan, to develop and monitor programs and services that promote gender equality and be more acceptable and appropriate for women living with HIV in all their diversity. And this guideline also seeks to uphold a human rights-based approach to health, recognizing the equal rights of all persons to the highest attainable standard of health and to be free from stigma and discrimination. But we have known for a long time that in the context of gender inequality, women and girls, transgender individuals, gender diverse people really face systemic disadvantage. They face systemic violence, stigma, discrimination, and barriers to access healthcare support and information. And we also know that when they are underserved or poorly served by the existing health system, individuals and communities living with HIV have worse health outcomes and are disproportionately vulnerable to violations of their sexual and reproductive rights. So it is really important in this context that while we have guidance and tools that have supportive language, that have evidence-based recommendations, that we need to do more collectively to ensure that the health outcomes of the women and girls can be advanced and their sexual and reproductive health rights and needs are met. So just very quickly, the next slide, please, Adas. And just very quickly, WHO, one of its mandates is to develop global guidance and guidelines to support member states on a range of health issues. Next slide. And the recommendations that we include in these guidelines are really based on a rigorous process that we follow that bring together a range of stakeholders. And for the guideline on women, SRHR of women living with HIV, a rather unique process was followed, and many of the women here on this webinar and others who have joined have been part of this process for either development or the dissemination. Next slide, please. The community engagement aspect has been really critical to this particular guideline development. Next slide. As were the guiding principles that some of which I've just outlined earlier. The women-centered approach was particularly important here. Next slide. And we started off with engaging women, networks of women living with HIV, to ask them first what their sexual and reproductive health needs and priorities were, and this was written up in this report that was led by and for women living with HIV that included Indigenous women living with HIV. Next slide, please. So the guidelines framework puts women at the center. You see that little house that was in the previous slide, which was part of the report of the Global Values and Preferences Survey, and the key principles of the women-centered approach: gender equality, human rights. It covers a range of the sexual and reproductive health topics and rights-based approaches, but also encompasses the need for a safe and supportive enabling environment, which includes food security, housing security, free of coercion and violence, community empowerment, and a range of issues in supportive laws and policies, access to justice, that we know in many cases and for many individuals, particularly from underserved communities, is either non-existent or not sufficiently available. So by including it in the guideline, it's not by any means to say, you know, this is how it is everywhere. This is what we would like to see happen and be available in all settings. Next slide, please. The areas covered in the guideline are those linked to the WHO Global Reproductive Health Strategy. I'm not going to read through this slide, just to say that this covers a range of the SRHR topics, but also cross-cutting issues such as gender-based violence, violence against women and girls, elimination of vertical transmission of HIV and other such areas. And just to say that the work in the development of this guideline actually started when this reproductive health strategy was published, which was in 2004. Very shortly after that, we established an interagency working group linking sexual and reproductive health and rights and HIV. And out of that came a range of global consultations on the SRHR of people living with HIV. which led to the first version of the guideline in 2006 and 2007. And so 10 years later, this guideline that we're talking about today was published. And we're now many more years later, and we know that more needs to be done for the implementation to ensure that these principles and recommendations are taken on board. Next slide, please. So these are some of the enabling environment pieces that I mentioned. Next slide. Recommendations that cover a range of areas related to the enabling environment as well as health interventions. And in the guideline, efforts have been made to ensure that the voices of women living with HIV are reflected in each of the recommendations. And you'll see the symbol of the house and the report of the Global Values and Preferences Survey that we used to alert the reader where these results were reported. Next slide, please. There are also good practice statements that cover a range of areas, including, that support the recommendations, but that include areas such as psychosocial support, the need for healthy sexuality across the life course, and the need for economic empowerment, as I mentioned earlier, community empowerment, supportive laws and policies, social inclusion, acceptance, and other such areas. Next slide, please. One of the outcomes that we had within WHO was the establishment of a WHO advisory group of women living with HIV that includes representatives of Indigenous women living with HIV from Canada. And this was quite unique in that WHO has a range of advisory groups. We have a lot of experts and expert advisory groups and technical advisory groups. This is the first and currently the only one that includes all representation from vulnerable communities. And it was established by the Director General of WHO, and the recommendations from this group are taken on board not only to inform guidance from sexual and reproductive health, but also from HIV. Next slide, please. And as I mentioned, effective implementation of this guideline is really going to need a lot of thinking with relation to the local context and really be responsive to the needs and rights of the women and girls whose health we are seeking to improve. And this guideline was disseminated and implemented in several countries. And what we have seen in each of those countries, and I'll give examples from the PAHO region. So for instance, in Panama, Trinidad and Tobago, Jamaica, and in Canada, and you will hear more about this, is that there are certain populations of women and girls living with HIV who are really disproportionately affected by the lack of quality services. And those include Indigenous women. And this has been, it's systematic. It's wherever we have seen this guideline disseminated and implemented, and where there are communities, Indigenous communities of women and girls and gender diverse individuals living with HIV, they are some of the communities that are that are not receiving quality care. So really far more needs to be done. I just wanted to share these beautiful words from Marama in New Zealand. And, you know, as I said, there were Indigenous women involved in the guideline development and dissemination. And we really look forward to hearing from you and from the experts who had been involved in, who are going to be involved in the national guideline and action plan in Canada. But also, if you have other feedback, this will be a living guideline, and we will continue to update and revise as needed. This slide shows the resources that are available from WHO, and there are more resources that will be coming on board soon. Thank you very, very much, and I look forward to feedback and questions later in the webinar. Thank you. And over to Angela.
Thanks, Manjula. Thank you so much, and welcome everybody. My name is Angela Kaida. I'm joined today with my colleague Jasmine Cotnam, and we would like to share with you our experience in Canada of starting with the WHO Consolidated Guideline and developing recommendations here nationally for a national action plan to advance sexual and reproductive health and rights of women living with HIV. So next slide, please, Ados. So I would just like to start by honoring the lands and waters on which I am privileged to live, learn, love, grow. I'm situated here on the unceded ancestral traditional territories of the Coast Salish people, including the Musqueam, Tsleil-Waututh, and Squamish First Nations, an area otherwise known as Vancouver. Next slide, please. So I wanted to briefly share with the attendees our process here in Canada of starting with the WHO Consolidated Guidelines to collectively work with partners and stakeholders across the country to develop our own key recommendations for advancing sexual and reproductive health and rights of women living with HIV. So here we started with the WHO Consolidated Guideline in 2017, as Manjula has just described for us. And once those were released, next click, Ados, we brought together a team, a partnership team here in Canada that was really centered on a national study called CHIWOS, the Canadian HIV Women's Sexual and Reproductive Health Cohort Study, that had already been created to create like a national infrastructure that involved stakeholders and leaders in women's sexual and reproductive health and rights across the country. And so this included clinicians, researchers, women living with HIV, frontline warriors, community-based organization leadership, policymakers, decision makers, etc. And together as a team, we decided what we needed to do was to develop a webinar series, really pull together some of the best practice that was happening in Canada around sexual and reproductive health and rights, as well as begin, a national conversation. Where were we as a country, and where did we want to go? And so in this webinar series, what we did collectively with this partnership team, as well as WHO representatives, is we delivered a 4-part series. The first webinar focused on trauma and violence-aware care and practice. That was considered a foundational priority for stakeholders across the country. The second webinar focused on supporting safer disclosure. And then we had a webinar that was on reproductive health, rights, and justice. And our final webinar was about resilience, self-efficacy, and peer support. So across this webinar series, what we brought forward was leading with the voices of women living with HIV in Canada and their priorities, supported by data that we had gathered through the national CHIWO study, and then bringing in best practice of programming and policy from teams across the country that were really, I think, at the leading edge of each of these topics. Once we did the webinar series, it became clear that we needed to have an in-person, remember those days, an in-person national consultation with stakeholders. And so we did that as part of the National HIV Conference in Canada called CAR. And at this in-person stakeholder event, we reviewed the webinars, and then we broke into a deliberative process of discussing what were the key recommendations that needed to be forefronted to develop a national action plan. Once we developed those key recommendations, next click, Ados, we opened up the process to an online stakeholder feedback process to make sure that voices that couldn't be with us in person at that event were able to weigh in. And then finally, we used all of this collective information to develop these recommendations. Next slide, please. We are about to publish these key recommendations in the journal Women's Health That work is in press, and so I'd be really delighted to share that publication with everybody as once it comes out. But essentially what that plan did is it came forward with 5 cross-cutting recommendations. So no matter which sexual and reproductive health topic you're focused on, these recommendations apply. Next slide, please. And I'd like to just give a very quick overview of what these key recommendations are. And then I'm going to turn it over to Jasmine to really breathe life into these recommendations and what they might mean for programming by, with, and for Indigenous women and girls living with HIV. So the first recommendation is central, which just says to us, meaningfully engage women living with HIV across research, policy, and practice that is aimed at addressing sexual and reproductive health and rights. The second recommendation speaks very explicitly to the need to centering Indigenous women's priorities, voices, and perspectives. This is about centering those priorities for Indigenous women and for all women living with HIV, and recognizing how much benefit there is to all by centering Indigenous women. The third recommendation really speaks to language and ensuring that across the board of the language we're using in sexual and reproductive health and rights, that language is actively destigmatizing, inclusive, and reflective of women's strengths and experiences, and not only this deficit-based approach. The fourth recommendation speaks to the need to strengthen knowledge translation efforts. This is essential to support access to and uptake of contemporary, up-to-date information for all stakeholders. And then a final recommendation was really speaking to the need to catalyze this reciprocal relationship between the evidence and evidence and action, so that action is driven by evidence and research is driven by what is needed for effective action. And so let me turn it over to you, Jasmine, to take us through some practical examples of what these recommendations might mean.
Hi, good day, everyone. I know we're joining from everywhere, so good day. So to meaningfully engage women living with HIV across research, policy practice aimed at advancing the sexual reproductive health and rights by, with, and for all women living with HIV, recognize and implement the essential expertise of women living with HIV in all levels within programming policy and whatever decisions are made. Meaningful engagement avoids the tokenism, provides sufficient training and compensation, and recognizes women's rights to self-determination and their own sexual and reproductive health, however they define that. Embedding peer support into services for women living with HIV and providing adequate compensation and support for peer leaders for their time, their expertise, is one example of meaningful engagement. Respond to the diversity of women, women's individual priorities, experiences, and identities to meet women where they are at by addressing specific needs of communities facing intersecting systemic and structural, I'm having a hard time with that one, that's a long one to say, structural inequities related to the colonization, racism, and gender. It's also a really hard thing to manage in life, so very important. And ground all efforts aimed at advancing sexual and reproductive health and rights of women living with HIV from an anti-oppressive framework, which does include acknowledgement and active disruption of patterns and experiences of systemic, institutional, and lateral violence. A lot of systems are put in place for people who are able to fit into the box, and being open to that is super important to make sure that the box fits for the woman that's being served, that is culturally responsive, etc. Move on to the next slide. So to center Indigenous women's priorities, voices, and perspectives in all efforts to advance sexual and reproductive health and rights of women living with HIV. And of course, you know, that would include here in so-called Canada, the Truth and Reconciliation Commission's call to action, but to actually sort out how they work in regards to this. Acknowledge and honor the strength of Indigenous women living with HIV. Draw from the traditional ways of knowing, doing, and healing and medicines. And that includes, you know, things that may not be, you know, prescriptive or may not seem from a medical model appropriate, but are actually very important to women's health. Next slide.
Hi, Jasmine. 2 more minutes left.
Thank you. Okay, so use language and terminologies that are actively destigmatizing, inclusive, reflective of women living with HIV, with their strengths and experiences for discussing sexual and reproductive health. You know, one of that is just a really common thing as somebody who works at a aid service organization. I hear staff and even sadder community members refer to themselves as HIV. So, you know, just that living with language is super important. And yeah, I'll move on to the next slide. Although when that one's very important, we can get back to it another time. Strength and expand the knowledge translation initiatives to support access and uptake of relevant and contemporary sexual and reproductive health rights for all stakeholders. Ensure that women living with HIV have access and understand their rights. A lot of people, a lot of women don't know that they're actually in a position of a partnership in health, or maybe haven't been positioned to be in a partnership with their health, and they actually are experts as well. Next slide. Okay, catalyze the reciprocal relationship between the evidence and action such that action on sexual and reproductive health and rights is guided by research evidence, and research is guided by what is needed and for effective action. Well, that'll just go straight down to consultation with community and member checking, ensure that the diverse expertise of all women living with HIV is integrated and honored throughout the process in a respectful and dignified way. And I'll move that back to you, Angela.
Thanks, Jasmine. And just to say for folks on the line that our next steps of our process are about implementing these recommendations with these stakeholders, including community-based organizations, clinics, and other decision makers. And on that note, I'll just thank our really national team of stakeholders who've contributed to this work. Thank you very much. And now we'll hand it over to our colleague, Laura Warren.
Good morning, good afternoon, everyone. My name is Laura, and I will be presenting some statistics from the Indigenous women who participated in CHIWOS. Next slide, please. Before I begin, I'd like to honor the Indigenous women who participated in CHIWOS and who have gone on before us. Next slide, please. So we heard the WHO's guidelines for a global plan. Then we heard about Canada's National Action Plan. Now I'm going to present some statistics from Indigenous women who participated in CHIWOS to provide support for the development of an action plan specific to Indigenous women living with HIV. Next slide, please. So CHIWOS is the Canadian HIV Women's Sexual and Reproductive Health Cohort Study. It was developed as an all-encompassing women-centered HIV care model to address the unique health and social needs of women living with HIV. CHIWOS is developed a longitudinal cohort study with 3 data collection time points called waves in CHIWOS, and 1,422 participants were enrolled nationally. Next slide, please. So this presentation will focus on wave 1, which is the baseline survey. Of the 1,422 women who were enrolled, 315 were Indigenous women who were born in Canada, which will be the focus of today's presentation. Next slide, please. I'll go over some of the sociodemographic characteristics to begin. Next slide, please. So women were enrolled in 3 provinces across Canada: British Columbia, Ontario, and Quebec. Just over half of the Indigenous participants lived in British Columbia, just under half lived in Ontario, and approximately 3% lived in Quebec. Next slide, please. Almost 70% of the women were between 30 and 50 years of age. About 20% were over 50, and about 10% were between 16 and 30 years of age. Next slide, please. 80% of the, almost 80% of the women identified as heterosexual, and about 20% identified as LGBTQ. Next slide, please. There was a relatively high level of education. 3 out of 4 participants had a high school degree or higher. Next slide, please. But despite this fact, the household gross yearly income was actually very low, where 80% of the women had household gross yearly incomes of less than $20,000 per year. So this is obviously cause for concern. Next slide, please. So we have a number of mental health characteristics that were included as part of the CHIVO survey. HIV stigma category was created from measures including personalized stigma, disclosure, public attitudes, and negative self-image. And so almost 60% of the Indigenous women had a high level of stigma. Racism and sexism were used as two measures of discrimination with moderate levels of both racism and sexism. Just under half of the women exhibited depressive symptoms as measured with the CESD scale. But despite the high level of stigma and discrimination, resiliency was remarkably high with a median score of 63 and the maximum score on the resiliency scale was 70. So this really speaks to the strength and determination of Indigenous women living with HIV. Next slide, please. Now I'll go through some sexual and reproductive health measures. Next slide, please. So the vast majority of women had a pap test, and of the women who had a pap test, 90% of them received the pap test within the recommended time frame, which is 2 to 3 years, depending on the province you're in within Canada. So that's good news. About half of the women had received gynecological care in the past 12 months. And of women 50 years of age or over, 75% had ever had a mammogram, but that means about 25% have never had a mammogram. So that's an area that we could certainly do better in. Next slide, please. Okay, so now talking a little bit about sexual activity and satisfaction. The majority of women have had consensual sex, and about 117 women were sexually active during the past month. And of those women who have had who were sexually active within the past month at the time of the survey, 85% were satisfied with their current sexual partner, which really speaks to the ownership of these women over their bodies and sexual satisfaction. Next slide, please. So of the women who were able to have children, 1 in 4 discussed their reproductive goals with their healthcare provider since knowing their HIV status, and 28 women have pregnancy intentions. Next slide, please. So that brings us to motherhood, which maybe people wouldn't necessarily think of this right off the bat, but motherhood, family are very important to Indigenous cultures, and the Indigenous women in Chivos have had over 178 children. There were a couple of live births, so I'm not exactly sure of the exact number, but I think this is a really heartwarming statistic. I know whenever I speak to the women, their eyes and faces light up when they speak about their children. So I think that this is a really positive thing in an area that is worth having greater support in to support these women in their motherhood journeys.
Laura, 1 minute left.
Okay, next slide, please. I'd like to end with some words from an elder that we work with at Chivos, Valerie Nicholson. When developing any kind of recommendations surrounding Indigenous women and Indigenous peoples in general, it's really important to know our differences, but perhaps more important is to honor our strengths. Thank you very much for your time. Our next speaker is Claudette Cardinal.
Thank you, Lauren. Hello. Hello, good morning, everyone, or afternoon. I'd like to introduce myself. My name is Wapokweni. I'm from the Musqueam clan, originally from Treaty 6 territory in Alberta, Canada. And I am speaking today on the unceded ancestral lands of the Coast Salish people and the Squamish, Tsleil-Waututh, and the Musqueam. Oh, where to start? Let's see. I'll bring you on the journey of how it's been living with this little virus I call HIV, and I've tagged I give certain words different meanings to the acronyms that we live with on a daily basis. We live with acronyms that are like, I even started a document about acronyms, of how we live in all these acronym worlds. So basically, I'm going to take you on a journey of when I contracted HIV and was told I was diagnosed in another province, my home province, and could not be seen by anyone there. So I'm healing inner voices and the vicarious trauma that comes with living with HIV and /AIDS. My body knew that I was carrying AIDS probably before I was diagnosed, because I probably picked it up in my wilder days, let's put it that way, and the street life and all that lovely stuff that goes along with that. I was diagnosed, like I said, 1995, CD4 of 250, body was really sick, like really thin. Didn't want to stay in Alberta. I thought of the great AA book and making those amends and going telling certain people and doing all these things. And I relooked and I came far. I came to the West. I came to the island and decided to take care of my health then. But then I was still not really adhering how I adhere today with my medications. I was sterilized when I came from Alberta to BC. Something I should have never went to that appointment that morning. It was a rainy day in Victoria, and that's the one thing I regret out of everything in my life. The one thing I regret, that I went along with those male doctors, and I just thought, I didn't know nothing about HIV back then, right? The side effects and everything, and I just like, oh, I can't take these pills, and side effects have been, with me the whole journey I've been on HIV meds. So that day, really kind of catapulted me into getting in touch with my own womanness, right? Because that was cut off. And how I dealt with that is because of the practicing culture of my people, of different ceremonies that I used to participate when I was younger, to re-engage with culture and relying on that, the medicines, the different support groups, all the different agencies I became a member of, to really shift my focus and not be angry. And this is where it led me to being part of the wonderful Chivos family. I am a grandmother. I'm a mother of four children. One, my firstborn I lost to overdose 7 years ago. I have 8 grandchildren, and I'm involved in this work and research because of the fact that, going by what my grandmother taught me, on my mom's side, my cookum, to be involved be involved with the sick. So I'm sick, and that's where I got involved with community, is to help other women and to uplift other women that are curious, that want to be involved, that have those abilities. We're here to help those other ones that are coming, to help them engage and be part of this important work. Just recently, I participated in another ceremony in regards to, I can't go home in Alberta, the weather, it's wintertime there, and because of a traumatic accident, trying to get home in the winter, I don't go back until it's thawed out and the roads are good. I recently went to go participate. It's called the Spirit Plate, so you honor the people that are dead. So I've done this ceremony for 7 years for my daughter. And that's how I mean that the culture really grounds me as an individual, and being part of the statistics and being a participant in the Chivos as well. I found that when somebody is sitting in the room with you that has the same illness. That's how Chivos collected this wonderful data, and how it's so important that women take that lead and be a force to be reckoned with, because of the fact that we have been suppressed for so long. And I'm speaking of all of my dear sisters in other less fortunate countries across the globe, and their fight, and how tragic their lives are. Let's see, what else can I say about, and through the lovely work that I do with Chivos and all projects that I involve myself in, is the fact that once you engage and take that step into the next box, wherever you want to see yourself as persons, individuals, speaking to any woman out there that would like to be involved, speak to somebody, talk to that person, and that's how it starts, with that one conversation with the individual that you're feeling comfortable enough to say, you know, I've been thinking, and that's how that starts. That's how that path for that individual will take place. Chivos has presented the next levels of my path into my own learning and continuing with the work and involving women, girls, boys, all genders, and to teach the next generation that's coming of how a long-time survivor gets through these things. And we have skills to pass on. And don't think that you're not worthy of being in these positions, because we have to be, in order for the work to get done in a proper way and to really enforce these guidelines. Hey. I'd like to pass it on to Renee.
Thank you very much. Wow. Thank you so much. This is a really, really wonderful and humbling opportunity to be part of the webinar together. I want to begin by acknowledging that I'm speaking to you from the other coast, Claudette, coast to coast, literally. I'm in the beautiful territory of the Mi'kmaq Nation on the east coast of Canada, and I hope that all of you are having a wonderful day, whatever time of day it is in your territory. Also want to begin by acknowledging that the stories and the work and the energy that goes into what we're talking about and presenting happens in a context that is supported by loved ones and people around us, our families, our families of choice, our families of origin, our families, our professional families. And just to take a moment to appreciate and acknowledge all of that energy that goes into allowing us to be able to be here today. There's a professional biography there on the screen. So just to briefly, my name is Renee Mashing. My work is as Director of Research with the Communities, Alliances and Networks. We've recently changed the name of our organization. My bloodlines are from Six Nations of the Grand River. It's my Indigenous ancestry. I'm also Irish descent. And I was adopted as an infant and raised in a family of Eastern and Western European descent. And all of that informs the perspective and energy that I bring to the work that we're doing. I have the privilege of presenting two presentations today, and this is in part to reflect self-care for our teams. So Marnie Amiro had looked forward to this presentation, but is unavailable today, and taking some time to spend good time with her family. And so I think that this is a little bit of a, you've heard it, and we're going to reinforce what's been presented. So the AHA Center is the HIV and AIDS Community-Based Research Collaborative Center, and it is a project of our organization, which we use the acronym CAN. And this is particularly focusing on thinking about how we bring to life and reinforce what we're learning and seeing as important in the context of sexual and reproductive health and rights. Next slide, please. So if we think about how do we get to the local, we're talking about, and Marnie's work with the AHA Center is particularly related to knowledge translation. And I think when we consider both challenges and opportunities and thinking about what knowledge translation involves, there's a kind of academic conversation that happens when we think about translating what we've learned, what we've researched, what we've talked about, what we've heard, and giving that back. And so we translate to different audiences in different languages. We think about knowledge to action and how we take that learning. No, we're right with the what does knowledge translation involve? Next slide. Yep. And also thinking about increasingly a conversation around knowledge mobilization. And so, you know, when we think about knowledge translation, we can think about work that happens at the end of a grant, or work that happens throughout. Increasingly thinking about these, you know, as we saw with the CHIWO's timeline, we really want to integrate knowledge translation so that when we think of these large long-term projects, we have an opportunity to give back throughout and discuss and dialogue. And I think that's all the ways that we achieve those recommendations that we heard from Jasmine and Angela about how we engage meaningfully with community. So, and in that regard, thinking about giving that knowledge back and when we use the term community in the context of our work at CAN, it's a very broad, big context. So community first and foremost, centered, much like we saw with the World Health Organization documentation, we're centering people living with HIV, people with living experience as the heart of our community. But the community that we work with as an Indigenous organization is inclusive of those with living experience, of those who are working on front lines, of those who are working maybe a step back and doing, you know, programming and organizational work, and goes all the way through different levels of influence up to a national, international level. And really, you know, for CAN, and I think for all of us in the way that we've spoken about the work that we're doing, the research that we're doing is all about promoting action, having influence, and making sure that we're taking steps that are going to improve people's lives. And I think, again, we've covered those other points. So if we go to the next slide, recognizing that knowledge translation and mobilization has many, many faces, including webinars. Really what the heart of effective knowledge translation is that we're working to align what we're talking about and the knowledge that we're sharing with community identified wants and needs. That's also the way that CAN has approached our research work, that we are guided by our members who have living experience so that we are investing our precious time and energy in research in areas that are our priority. Of course, as we work at this national level from coast to coast in Canada, the challenge is to think about how do we adapt to local community and follow cultural protocol. Some of those examples in our work have included when we're doing data gathering, when we're hosting events, that we really seek out leaders and guidance in those places that we're going to be engaging. In the context of this big project that Patricia talked about in our international work, that's inclusive of saying when we come to different countries, we bring our experiences and perspectives from Canada, but really, really want to walk humbly and respectfully in those other places so that we follow protocols and expectations of the territories where we're visiting. And when we think about good knowledge translation, when it's effective, when it's successful, when somebody walks away and says, ha, I've learned something new, that really we've been successful in understanding the audience that we're talking with and the wording and language and imagery that will be most meaningful. Next slide, please. So just as a lovely transition, this is a beautiful photograph from the East Coast, not very far from where I'm standing now in my office, and just calling us in to think about particularly moving from broad considerations of knowledge translation to thinking more specifically about engaging with Indigenous communities. And the next slide. So, you know, very often in the work that we're doing, we walk in these two worlds where we are connected tightly and strongly to the Indigenous community, and many of us also bring experiences that have been grounded in academic and often Western institutions that are teaching us about these concepts of knowledge translation, for example, and mobilizing that knowledge. So when we think particularly about what it means to frame Indigenous ways of knowing and doing, to bring our cultural understanding and the diversity of our cultures into the work that we're doing. We look at the process of knowledge translation and really dive into and understand that we're seeking to be culturally relevant, and to, I think, Laura, as you presented with looking at the analysis of the CHIWOS data, that we're really thinking about and understanding what is useful health information and how that shapes what we know about living a good life. And so that in all of this data and all of the information and the beautiful things that we learn and understand and gather in our research work, that we really seek out the information that is helpful and meaningful, important for us to understand the foundation that we're working from, and then the key considerations and the key insights, you know, understanding how central motherhood is to the story that we're talking about in the context of sexual and reproductive health rights for women, and frankly, parenthood, when we're thinking about our full community and the responsibilities that go with understanding human rights and sexual and reproductive health rights specifically. When we think of Indigenous ways of knowing and doing, and this is reflected already in our presentations as well, elders have a very special role. And Sharp, thank you so much in that context for helping us to open today in a good way. And when we think of the roles of elders in terms of helping us to understand Indigenous worldviews, to bring that reminder and that reflection of how our cultures influence the way that we're doing our work, to bring teachings that we may be gifted and need to sit with and think about for a little bit and come back to, you know, maybe some of the head work that we're doing. Elders often help us to take that journey from our heads to our hearts, and really help to, I think, to go back to that thought of what is important information and useful information, and perhaps also how can we understand the context of what we're learning in the way that it might be relevant to our communities and to our peoples. And we've had this beautiful gift of Sean Wilson's work that framed research as ceremony. This was part of a thesis that he wrote, and it's just been taken up because it's so exciting to think about research as in a context of Indigenous ways of knowing and doing, when we've had so many stories of being researched to death. That research could be bringing us to life, that it could be sacred and a ceremony, and that it would be something that we can both integrate ceremony in the way that we're doing our research work, as well as actually understanding that research process itself as something sacred and respectful and special, and something that is deeply a part of our cultural context. And of course, that influences, as I'm thinking about this particular presentation, the way that we approach giving that knowledge back. And so it's our responsibility to share knowledge and apply it to apply it in life for the benefit of everyone, and to share knowledge and research knowledge, you know, so that we're not asking people to give of their time and their stories to be asked to relive experiences and then to put that on the shelf. That's just absolutely, you know, this is where we've started to move in our language around knowledge translation, to add words like knowledge translation to action and knowledge translation and mobilization. Understanding that stories and knowledge hold medicine. And this is where our ceremony and the sacredness of what we're involved in, and the work that we've done that's already been presented from the work that's happened internationally and nationally to be able to move this forward. And so when we want to give back at the local level, and this is really, I hope, reinforcing all of those 5 key recommendations that came out of our national work, that when we give back, that we understand that knowledge translation is relational. And I think it really mirrors beautifully what was presented by Jasmine and Angela. If we go to the next slide, trying to just be mindful of being maybe a little bit more specific in terms of thinking about, you know, how do we choose a knowledge translation strategy? These are 5 questions that can help us to think about how we're going to proceed. And of course, from CAN's perspective as a national organization, these questions have multiple answers, right? So what is the message and who is developing it? So what is the message around sexual and reproductive health rights? And we know that there are many messages and many key points that we want to promote. Who is developing it, and how do we introduce This came from an international level. It's filtered through a national level. It's filtered through the programming organization and work that we're doing. And this is CAN's perspective, but I would invite all of you to consider in the places where you live, work, and play, who you are, as the people who are helping to develop and digest what you're learning, how are we shaping? This is where it came from, and this is how I'm giving it back. Who are we delivering it to? Who's our audience? What's the scope of influence of that audience? And how might that community respond to the messenger? So as an older woman who identifies as Indigenous with very pale skin, what does that mean in terms of walking into a room of young women who are maybe living in an isolated community? And how do I need to be mindful of presenting and walking and being in that space and being as accessible as possible? How to deliver a message? Do we use a webinar? Do we use technology? Do we sit together? Do we send out materials? Do we offer resources? Do we do all of those things? And I think it's really important and exciting to think about, what do we expect to come out of this? What do we expect the impact to be? What do we expect the impact to be of a webinar? What do we expect the impact to be of handing somebody a pamphlet? And this is certainly, in part answered by evaluation questions and follow-up. I think that's an area that we really could learn more and invest more in thinking about what the expected impact is and how do we bring that to life. If we go to the next slide and just think about in this presentation, thinking about challenges and opportunities. And I think this is actually could be a challenges / opportunities in knowledge translation slide, that we really, and this is so completely reinforcing what's already been said, we have to have the involvement of the people whose lives we're talking about, whose lives are being influenced by what we're sharing and thinking about. If we're thinking about sexual and reproductive health and rights, are we understanding our own capacities and roles in that, as well as for those who we are advocating and working with? That when we talk about effectively advancing our work, we need to include time for trust building and relationship building. I can't walk into that community, that isolated community, and I could walk in as the expert, but I may not be as effective if I walk in and take time to get to know people and let them get to know me. And that we know that one size doesn't fit all. So there are many, many strategies and many ways that we want to approach and continue to make information available and accessible. And of course, right along with that is how ready people are to hear from us. So how have we laid the groundwork? And that takes us to the next slide, which is focusing on tips for success. And one of my most favorite, and I know that Marnie's really enjoyed this and has chosen a photograph that really reinforces it, is the conceptualization of 10 cups of tea. Now, it could be coffee, could be water, could be pop, could be not actually a beverage at all, but it's that idea that when we're engaging in research work, when we're talking about sharing knowledge and information, that we really want to spend time together, that relationship building, the part that's so critical. And that we all have so much to offer to each other. So that opportunity to bridge capacities and to hear from each other and give to each other and make room for learning together. And I think I'm looking at time, Sugandhi, and you're going to tell me I have 1 minute left, and I've just used Marnie's presentation. I haven't done mine, but I think that really the two relate well. So the next slide is some contact information, an acknowledgement.
Good for time, Renee, no worries.
Sorry?
Sorry, I was just going to say you're doing good for time, no worries.
Perfect. Okay, thank you. So just great opportunities to check out our website for the AHA Center specifically, acknowledging our important funding from SRHR and also some contact information from Marnie. And that was just in the previous slide, but I know we've gone to the next presentation. Thank you so much. Bearing in mind this is the last presenter, I might not have much to say. The next slide, having had the chance to offer that acknowledgement. The presentation that I was asked to contribute was to operationalizing the guidelines. And again, I think that, that process of really bringing things to life is what we want to talk about. And I think there have been some fantastic and beautiful examples throughout this presentation already about what it means to concretely think about addressing these guidelines and bringing them into everyday life. And so as I thought about this, these 4 circles, and there's many more circles that we could add, but that recognizing and respecting sexual reproductive health and rights and entrenching that really happens. These are 4 vehicles or 4 opportunities, 4 pools where we might be most influential. And thinking about in ceremony and how that relates to the ways that we engage in ceremony, not just the beauty and power of grounding ourselves in a spiritual space, but also in terms of how we design ceremony, how we welcome people into ceremony. When we think of policy making, that policy making, as a parent might range from this is the way we do things in our house, all the way up to how we want to influence governments and international bodies in terms of how we understand and create an enabling environment that we spoke of in the beginning. The communication and knowledge translation are so intimately integrated, and programming, thinking about some of the ways that we do our work within CAN and the bridges that we're building between programming and research. And I have so much more to say, but I'm going to be mindful of time and just jump to the very last slide. And just some strategies to consider. And I think, this is, again, linking what we know with what we do all the time in all of our conversations. So what we know about the ways that we create positive and safe spaces, the importance and value of talking about sexual health, of demystifying sexual health, of teaching our children to use proper names for their body parts, and all the way through to every opportunity we have to talk to somebody, and just, it doesn't have to be a lecture, but to have those places of reinforcing how wonderful it is and how valuable and important it is when we see somebody exhibiting those positive aspects of sexual health and reproductive health that we want to see for all people in all ways. And one of the lessons that we learned at CAN that is surprisingly obvious, but wasn't at the moment, was really, let's do more presentations about what we should do. We had done so much work in our research investigating barriers and rallying around the problems and the issues and the concerns that were holding us back, that we hadn't realized and hadn't necessarily paid as close attention to the stories of success. And when we were challenged by that, we ended up in a situation with research data that was coming back saying to us, this is pretty good. People are getting good care. They're having good relationships with practitioners. It shifted us to stop talking, or to expand talking about barriers to also talking about facilitators, and then led to presentations that talked about these are things you should do, as opposed to stop doing this and don't do this, and this is very harmful. And it's important to say stop doing this, this is harmful, but it's even more powerful to say, and this is positive, this is not harmful, these are good things that you should be doing. And I think, again, just maybe to end off, when we think about considering our audience and the scope of influence of the audience that we're talking to, right? When we're talking to the teachers and the work that they're going to do in the classroom, through to speaking to people who have, are able to speak to large groups of people, so that we're giving information and encouraging the people to work within their sphere of influence. And take time to learn about that. I find, I'll often make assumptions that I need to double check. I think that you're a very important person, so-and-so. Tell me more about how you, who do you interact with, and how do you share information? What can I put in your hands that would really help you? What do people care about who you talk to? And so learn about that context. And again, have a cup of tea. Have 2 cups.
Renee, you have 1 minute left.
Perfect, thank you. And I think that in that regard, being clear about our core messages, and this is where we go all the way back to the beginning to our presentation and think about those very clear perspectives about the core areas where we know that we need to be paying attention, that if we keep singing our songs and we keep bringing forward those core messages, that helps to create that enabling environment where we see change happening. And I just, I'll end there and thank those who are on the call, and just so privileged to be part of this amazing panel. Thank you very, very much.
Thank you, Renee. And thank you, merci, and muchísimas gracias to all of our wonderful presenters for your incredible insights and knowledge. It was a pleasure to listen to you all speak. I'm now going to look through the question box to see if there are any questions. I have a few up my sleeve. If there aren't any questions from the floor, I'll give it another, I'll count to 10 in my head and see if any questions show up in the chat. Okay, that was 10 seconds in my head, which felt like a lifetime. So I have 2 questions that are for everyone. And then depending on time, I see I have a few messages here about questions for specific presenters. I'm going to start with a big picture question. This is for any of the presenters who want to tackle this one. This year, the International AIDS Conference will be in Montreal, Canada. What are some topics or issues that you hope come up at the conference, and what would you like to see happen after? And for instance, if someone at the conference asked you, what are Canada's top 3 HIV issues among Indigenous women, what would you say to them? Okay, not everyone at once.
Well, I think from Ken's perspective, are there others unmuted and available, or am I? So top 3 issues. I think we'd certainly start with talking about sexual and reproductive health rights, right? And really bringing forward the rights of our women to be wholly and fully sexual beings, to and to have that respect. And I think about what lessons we've learned from TRIWOS around the needs for positive healthcare and the excitement. This is why we're here. This is why we've got a research project specifically to address it. And I can only imagine that Jasmine and Claudette, that responding to stigma and discrimination, and again in a strengths-based approach, that we continue to promote messages like we love positive women, right? That we move beyond the hurtful messages and really fill the space with the positive, loving messages, and that we drown out the negative and not deny it, not ignore it, but we drown it out by filling that space with positivity.
Thank you, Renee. That was wonderful. Would any of the other presenters like to chime in? Just checking the time. Okay, we're doing okay. Angela, go for it.
Hi, I mean, I'll speak as somebody who practices allyship with Indigenous women living with HIV. And in my work as a researcher, I think the learnings and approaches and methodologies that are being developed, put forward, advanced by folks involved in research with Indigenous women living with HIV have transformative power for all women. And I really appreciate that the Indigenous women living with HIV have their own sections at conferences, etc., and that's usually attended by other folks working in Indigenous health. But I really want to put a call out there for all of us, and how much there is to learn and benefit from understanding and learning about Indigenous approaches, Indigenous ways of knowing. Research as ceremony is transformative for all of us engaged in research in the HIV space. And I really hope that that is something that emerges from AIDS 2022 in Montreal.
Thank you, Angela. Claudette and Laura, I see that the cameras have come on. Would either
I'll
of you?
give a stab at it. The one that comes up is what we're here today in celebrating, the sexual rights and health, sexual, reproductive, and health rights of women and girls. That's one. I love that tea thingy. I don't know how many cups of tea I'm up to, but that's, I've had a lot of things. What was I going to say? Oh, the involvement of individual women at the table. That's forefront. We have to be in every little nook and cranny in order for that work to be represented in the right way, right? What was I going to say? I forgot it. I need more coffee. No. One more thing. Let's see. That the tea and the engagement of women, it's so important that, and also language. So I'm just going to correct you on, if you haven't read the manuscript that's out there from Thrive. I'm on another team that was awarded for community-based research second time in a row. Chivos was my one award in 2019, and this year for CAR, another repeat offender, 2-time award winner for community-based research. The language is a thing that I made apparent to my team in Thrive. It's a study with older adults living with HIV. And I just let you read it, Google it, manuscript from, I think it was, I came up with the title, Embracing Two-Eyed Seeing, and stuff like that is in the Journal of Aging, the study of aging, genealogy, or I can't even say it, but aging. And what I termed and was schooling everybody about, there's challengers, that's I can let it go sometimes. Some of the challenges are all right, but the one that I fixed and switched over and said that sometimes when we are in the research realm, certain words have triggers for certain individuals, and the trigger words for me were barriers and facilitators. So I changed it and said, as a softer language, so for me as an individual, this is what I expressed to the team. I said, for barriers, and as an Indigenous woman, when you say barriers, it's like, okay, I don't need to go any further. I'm stopped. I don't need to engage with nobody anymore. And for facilitators, it's like everybody else is up in my business. Okay, so I switched it for more softer, open language, and it's now deemed, because of this Indigenous person, as pathways or obstacles for barriers and pathways for facilitators. So I just want to let you know about how important that, by us being at these tables, how important we can make change. Okay.
Thank you, Claudette. Would anyone else like to speak?
Hi, I'm just going to say thank you so much for everybody's input. It's been a really it's very humbling to listen to all this feedback. I would say, the importance of research, of continued research. It's so for us sitting at where I'm sitting at WHO, we are so dependent on that things should be based on the evidence. What is the evidence, and what how do we view that evidence, and who views that evidence, and so this continued research that's happening through Chivos and through others that and having that published, having that available to others beyond the communities in which you work is just, it continues to be so important. And many of you mentioned language, and I think it's really important to have inclusive language. And sometimes particularly related to gender, there's a difference between gender neutral languages and gender inclusive languages that's respectful, that's supportive and reflective of the needs of the individuals that we would like to address or to include. So there's still a lot of patriarchy. There's still a lot of racism. There was some mention in one of the recommendations about decolonization, and all of these elements are now coming to the forefront. There's a lot more discussion about this on the global agenda, and there's a tremendous amount of work that can come out from the groups in Canada, as I've seen in the past, and this can really inform a more global agenda and thinking to address the SRHR of women, girls, and gender diverse individuals. Thank you.
Thank you, Manjula. There is a question for Renee in the chat. I'll read it out loud. Through knowledge translation, how does one ensure that action taken by communities to, oh, sorry, it's scrolling on its own. Bear with me. Okay. Through knowledge translation, how does one ensure that the recommendations are taking, that the recommendations have taken action on communities to, I'm sorry guys, it keeps scrolling on its own. There we go. Okay. Attempt number 3, this is the golden one. Through knowledge translation, how does one ensure that recommendations are taken on for action by communities to an ending project? How is feedback sustained?
That's a really good question. And I think, I'd love to say that there are lots of ways that we can ensure. I think, unfortunately, is that there's a leap of faith that also happens, right? That we do the very best we can. So I think that from Can's experience, and certainly from a context where we jump from project to project and really wish that there was more time, it is about how we entrench those core messages and carry them forward. And so that we have a responsibility and hopefully opportunities to really continue to weave what we learn and how we carry our work. It's what we learn, from this work, from this presentation, for example, gets woven into everything that we do going forward. If we've heard Thomas King's stories, he'll often end his lectures saying, you've heard this now. I'm not quoting him fully, but it's that notion of you've heard this story now. So what you do with it is your choice, but you can't say you didn't know. And so I think that our opportunity and our obligation, and that's what I was hoping to kind of say in that last slide about keep reinforcing what we know, keep sharing what we know, so that we have that opportunity, as you said, Manjula, to refer back to publications, to resources, to point to, here is something that I can carry forward, whether the project is continuing or not, but it's also, I have that opportunity to continue to sing this song. And so if I left Can tomorrow, that in my new job at Tim Hortons, when I'm giving somebody a coffee, I would say, hey, today is Sexual Health and Reproductive Awareness Day. Have a great day. Today is World AIDS Day. Hey, you know what? Today you're looking absolutely wonderful. All those ways that we know that we create positive environments, or that we create, so that really are opportunities. And it's not, in a big academic sense, that is certainly not our end goal. But I think in an honest and realistic sense, and in our day-to-day, it really is those small actions that can, in fact, add up. So I hope that's at least the beginning of a useful answer.
Excellent. Thank you, Renee. And thank you to everyone joining us today. Thank you to the presenters and organizers for this wonderful session. Thank you especially to Patricia Maecha and Ados May for all the behind-the-scenes work that you do. And before I turn it back to Sharp, I'll mention again to share what you heard and learned today on social media and tag Can on Twitter at Can, CAAN_official. Thank you, everyone. I'll turn it over to Sharp.
Oh, miigwech. Isn't it interesting how we always think about this time in our time together as an ending? And many of my elders have talked to me about, it's not about an ending, it's about a new beginning. Just like that, the way that those who've come before us have been dancing around this whole presentation today. I've heard them. The importance of those cups of tea around a table, and if we could sit around those tables and talk about sexuality and health and all of those beautiful, wonderful things that are such a powerful gift from Gijiminido. The same way as we talk about how deadly that fry bread was. If we could talk about it in just that way, because when you get down to it, it is all really about tacos. What a beautiful gift is sexuality. So it isn't an ending. It's a beginning. It's a circle that never ends. The that circles back and forth and around, just like I heard that all the water that's in the world is all the water that's ever been in the world. And it comes and goes between heaven and earth, and it comes and goes from our mouth and out our body into the earth and around and around. And so we nourish one another and we nourish the earth. And in that way we have balance. So until we meet again, Pamapi, Minwako all my relations. Have a great day, folks.
Thank you.
Have a good day, everyone.
Yeah, thank you so much, everyone.
Can
Thank
I
you, everyone.
share? Can I
Thank
share one thing? Ados, he sent me a picture. Sorry, Ados, I'm just outing you. While I was speaking, and this is how the spirits work. I'm showing you. This is from, there was a cardinal sitting on out his window while I was speaking. So it just shows you how the spirits work. Have a good day.
Excellent. Thank you, everyone. Have a great day, great evening, great night.
See you
Bye.
later.
Thank you.
Bye. Bye-bye.